Good day, everyone. Welcome to ISQua 37th International Conference, taking place virtually due to the COVID-19 pandemic, the new normal. I'm Dr. Temitope Bakare from Orile Agege General Hospital, Lagos, Nigeria. I'm presenting hepatitis B vaccination uptake among healthcare workers, an occupational health and safety project in a Nigerian hospital. Introduction. The seroprevalence of hepatitis B virus infection in Nigeria is 12.2%, while rates are about 4 times higher among healthcare workers who represent a high-risk category. Though preventable through vaccination and post-exposure immunoglobulin therapy, multifaceted reasons are adduced for low uptake of the vaccine in Nigeria. 2 reported incidents of needle prick with hepatitis B positive patients within 2 months led to renewed efforts to vaccinate the staff of Orile Agege General Hospital, Lagos, Nigeria. Aim statements. To vaccinate against hepatitis B in Orile Agege General Hospital staff from 10% to 50% from March 5th, 2019 to September 5th, 2019. Objectives. This study had a strong focus on the primary prevention of hazards and ensuring safety in the workplace. This will prevent work-related illness and injury. Methods. We utilized the model for improvement in this descriptive study. Ethical clearance was obtained from the Research Ethics Committee of the Health Facility. A survey carried out by the Quality Improvement Team revealed only 10% of Orile Agege General staff had been fully vaccinated. The 5 whys was the quality improvement tool used to explore the cause and effect relationships underlying why only 10% of staff had completed the 3 doses of immunization. Cost of the vaccine, poorly communicated policy, low risk perception, insufficient information, and inadequate follow-up processes were our findings. Change ideas. Change ideas were implemented using plan, do, study, act, PDSA cycles. The interventions were 1, occupational health talk on needle stick injuries, transmission and prevention of hepatitis B virus during the Orile Agege General Hospital Staff Assembly, which holds once a month. This was then followed by free screening for hepatitis B virus amongst OAGH staff. Finally, all consenting staff received the recombinant hepatitis B vaccine at 0, 1, and 6 months. Results. The outcome measure, which relates to the aim statement, please remember our aim statement was 1, to vaccinate against hepatitis B in OAGH staff, which was the proportion of, the outcome measure is the proportion of staff who completed the 3 doses of hepatitis B vaccine. A total of 316 staff, which is about 58.6%, received the first dose of the vaccine, while 312, which is about 57.9%, received the second dose. However, it was surprising to find that only 48.2% of staff received the 3rd dose. Long vaccination schedule and lack of time were reasons given by staff, despite the fact that the vaccination exercise was completely free. In addition, hepatitis B vaccine refusal was high among those who tested negative during the initial screening for hepatitis B virus, with some erroneously opining that the vaccine could cause infection, hence their refusal to participate in the 3 doses vaccination. Compliance was highest amongst the nurses. 83 nurses participated out of a total of 127 nurses. We had 65.4% compliance with the nurses. Significant improvements were observed post-intervention compared to baseline levels. The process measure, which relates to the 3 change ideas. I want to recap briefly, which is occupational health talk. 2, we had free screening for hepatitis B virus. And lastly, all consenting staff receiving the vaccine. The process measure, which relates to the 3 change ideas, revealed that only 249 staff out of a total of 539 staff, which is 46.2%, attended the occupational health talk during the staff assembly, while the proportions of staff screened for the hepatitis B virus was 75%. Only 3 staff tested positive to the hepatitis B virus during the screening exercise. Further investigations and treatment has since been carried out on them. In conclusion, occupational health talks improved the level of hepatitis B vaccine immunization completion from 10% to almost 50%, approximately 48.2% in Orile Agege General Hospital. This study demonstrates that attitudes to uptake can be eliminated via continuous education, and that vaccination coverage can significantly increase among health workers through the use of well-designed quality improvement interventions. At the end of the study, vaccination of all newly deployed and recruited staff was adopted and adapted into the Orile Agege General Hospital orientation program. Thank you for listening.